Welcome you all. So today we will discuss about IgA nephropathy. So in IgA nephropathy, two things is important. The first thing is there is hematuria. Hematuria, which is maybe episodic, which may be gross hematuria, which may be microscopic hematuria. Hematuria associated with the deposition of IgA in the mesenterium of kidney, then the diagnosis is IgA nephropathy. So it is otherwise known as Burgers disease. So why it is known as Burgers disease? So scientist Burger, who first introduced this disease, named as glomerulonephritis. Later on, it is called as IgA nephropathy. So it is one of the most common type of glomerulonephritis. Okay. So IgA nephropathy is episodic or gross or microscopic hematuria with IgA, deposition of IgA in mesenterium. So go to its etiopathogenesis. So how it started? So it is manifested after acute bacterial viral infection of a respiratory organ or gastrointestinal organ. So when this either a respiratory or gastrointestinal exposure to virus or bacteria, there is increased synthesis of IgA in the body, and this IgA travels in the blood, go to the kidney, and it is in the filter in the process of filtration. This IgA immune complex entrapped in the mesenterium of the kidney. So these two organs may affected by some bacterial virus. Then there is increased production of IgA, which is during the process of filtration, it is entrapped in the mesenterium. So then IgA nephropathy will be happened. So in microscopic, you will see that there is microscopic means a biopsy test. We collect some piece of kidney, small piece of kidney, and put in the microscope. You will see that there is a messenger of proliferative glomerulonephritis. And in immunofluorescence, there is mesangial IgA with C3 and propyridine. These are the glycoproteins which is present associated with IgA. And in IgA nephropathy, this C3 level, complement component 3, is either normal or increased. Okay. And on electron microscope, this electron dense deposition of IgA in the mesenterium will be seen. On clinical feature, the diagnosis may be happened only by the clinical feature. There is hematuria after 24 hours, within 24 to 48 hours. This is important. This is very important in IgA nephropathy. The time period 24 to 48 hours after a respiratory or pharyngeal infection or GI infection. So after pharyngeal or respiratory organ infection or GI infection, if there is hematuria, within this period, then diagnosis is IgA nephropathy. In an examination, question will appear that after pharyngitis within 24 hours, if there is hematuria in a children age 12, what is the most probable diagnosis? The diagnosis is IgA nephropathy. As you know, it may be gross hematuria or a microscopic hematuria. Okay, and this is important. Proteinuria may or may not be present in IgA nephropathy. In some question, there is a question may be appear that proteinuria is always associated with IgA nephropathy. True or false? It is false, because it is may be present or may not be present. Okay, so this is all about IgA nephropathy. So what happened? Hematuria with IgA deposition in the mesangium after respiratory gastrointestinal infection by the bacteria or virus within 24 to 48 hours. If this IgA deposited in the mesangium produce hematuria, then it is IgA nephropathy. Most commonly, mesengoproliferative glomerulonephritis is microscopic, and the C3 and propyridine glycoprotein will present associated with IgA in the immunofluorescence. And the clinical feature: gross hematuria within 24 to 48 hours after acute pharyngeal or GI infection. And keep in mind that hypertension is not associated with this disease. So sometimes you may be confused during entrance examination. There may be a question that a hematuria after 1 to 3 weeks after acute pharyngitis or any infection. If it is not within 24 to 48 hours or after 1 week, then the diagnosis is not IgA nephropathy. It is post-streptococcal. Post-streptococcal. It is streptococcal. Spelling mistake. Post-streptococcal glomerulonephritis. Okay. Post-streptococcal glomerulonephritis. So in a IgA nephropathy, 24 to 48 hours after acute infection, if hematuria. If it is 1 week or 3 weeks after acute infection, there is hematuria, then it is post-streptococcal glomerulonephritis. And most important part is the C3 component is reduced in post-streptococcal infection, post-streptococcal glomerulonephritis. C3 is reduced, where in IgA nephropathy C3 is normal or increased, and as it is post-streptococcal infection, the ASO will be high. Okay, so sometimes in examination another question will be there, that is glomerulonephritis. Goodpasture syndrome. In Goodpasture syndrome, there is also hematuria. So what is the difference? Difference is always associated with hemoptysis, because in a Goodpasture syndrome, two organs is affected, is respiratory and kidney. So in a respiratory there is hemoptysis, in kidney there is hematuria with anti-GBM antibody, that is anti-glomerular basement membrane antibody. So hematuria with hemoptysis, if it is present, the diagnosis is Goodpasture syndrome. It hematuria within 24 hours or 48 hours, then the answer is IgA nephropathy. If it is hematuria after 1 week, then it is diagnosed as this post-streptococcal glomerulonephritis. So this is all about. So then we go to the question. Question number 1. A 12-year-old Ram or any name present with gross hematuria with 80% dysmorphic RBC after 2 days after a attack of upper respiratory tract infection. Diagnosis is what? So in an examination, you read carefully. So what happened? Clinically, hematuria 2 days after acute upper respiratory tract infection. Diagnosis is IgA nephropathy. Okay. The next question is IgA nephropathy seen in dash. So in membranous glomerulonephritis or mesengoproliferative glomerulonephritis, focal glomerulonephritis or crescentic glomerulonephritis. So in a microscopic, you will see mesengoproliferative glomerulonephritis. So answer is B. So in examination, read the question very carefully. Sometimes this question may be present if in this question this 2 days is not present. If it is 2 week, then the answer is post-streptococcal glomerulonephritis. If it is gross hematuria plus hemoptysis, then the answer is good passer syndrome. Okay. So this is all about today's class. Thank you very much for your patience hearing.